one of the strongest predictors of mortality, disease, physical well-being, all things that we care about in medicine, is lifestyle. You're trying to instill in your patients the value of taking care of your body, eating healthy, and then they might come in 6 months later and you might not maybe see the progress that you were expecting from them. Access to healthy, quality foods can be limited depending on even just what neighborhood you're in, your zip code. And after 6 months, come in again and there's no improvement, to think that, oh, this patient is just non-compliant, they're just not adherent, they don't care enough about their health. But I think one thing we have to keep in mind is hey, my name is James Charpentier, and welcome to Less Than 3%, where we talk about healthcare, my journey becoming a physician, and diverse perspectives in medicine. In this episode, I want to talk about something that I think is very, very crucial to the field of medicine. I think it's something that we definitely need to keep in mind, and I'm definitely excited to talk about with you guys. And before we get into that, just want to let you know, if you're watching on YouTube, please feel free to hit the subscribe button, hit the notifications for more videos, share this with someone that you think might enjoy it. And if you're listening on a streaming platform, share this episode with somebody you think would learn a lot from it. And feel free to give the podcast a follow. Now, in this episode, I think there's so many different things that we have to think about when it comes to community health. Not just the health of like one individual person, but ultimately the health of entire communities, because that's something that we want to be able to have an impact on as people going into the field of medicine. And I think one thing that maybe sometimes can go unnoticed is the fact that one of the strongest predictors of mortality, disease, physical well-being, all things that we care about in medicine, is lifestyle. Your lifestyle plays a key role in your health. It's something that I think does get talked about a lot when it comes to preventative care. And I think it's such an important factor that we need to keep in mind in medicine. Now, again, things like our eating habits, our sleep patterns, maybe even how much time we spend looking at our phones, like all these different things, I think all of us know that they have an impact on our health. And it's often said that we need to be able to eat healthy if we want to be in a good state of health. I think that's something that a lot of us kind of understand, even though it can maybe be a little bit harder to live. Now, of course, preventative care, regular checkups, healthy lifestyle, all those things are ultimately going to contribute to our health outcomes. But at the same time, I think we also have to recognize that there can be a lot of challenges for people when it comes to ultimately being able to be healthy. And there's a lot of questions that can come from that. Now, I can just imagine from a physician's perspective, you're trying to instill in your patients the value of taking care of your body, eating healthy, sleeping right, all those different things. And a lot of times you can have patients come in and you can talk to them about some of the different things they can improve with their health, hoping that they'll be able to make the right adjustments. And then they might come in 6 months later and you might not maybe see the progress that you were expecting from them. Now, I think it can seem like healthy eating and ultimately being adherent to a specific plan can seem a little difficult for some patients versus others. And I think there's a temptation to look at patients and be like, why do they seem to be non-compliant and why are they adhering to what we want them to do? But I think there's a number of challenges that sometimes, unfortunately, can go unnoticed that connects to why healthy eating and exercise and all these things can be difficult for some. And there's major problems that I would say extend to throughout the entire country when it comes to ultimately people being able to eat healthy and take care of their lifestyle. And the specific thing that I want to highlight in this episode is the issue of food insecurity. Something that I think can go unnoticed is the fact that your access to quality foods is very important when it comes to ultimately being able to take care of your health. Now, I want to highlight a couple things here. First of all, let's just start off with the term food insecurity. What exactly is that for those listening that might not have an idea of that? So what I want to do is I want to take an official definition from the Office of Disease Prevention and Health Promotion. And I want to talk about what exactly this thing of food insecurity is. Now, according to them, food insecurity is defined as household level economic and social condition of limited or uncertain access to food, to adequate food. Now, this is something that and it may come as a surprise to some people, but this is something that impacts a very, very large population of people across this country. As they even say, looking back at 2020, 13.8 million households were food insecure at some time during that year. So food insecurity is something that impacts millions of people. Access to healthy, quality foods can be limited depending on even just what neighborhood you're in. Your zip code can say a lot about how much access you have to quality foods. And as I'm going to get into this, ultimately, your health outcomes. I want to point out another term. This is something that I've talked about in the past on the podcast, if you go back to even the first season of the podcast. But I think it's something I want to emphasize right now, and that's the concept of food deserts. So what exactly is a food desert? I'm going to spell that out for you guys. I'm taking this from medicalnewstoday.com because I think they do a great job of giving us an idea of what exactly a food desert is. But the concept of a food desert, and again, this is going to connect to food insecurity. Food deserts are areas where people have limited access to a variety of healthy foods. So that may be due to a number of things: a lack of nearby stores selling fresh produce, a lack of transportation, or poverty and high costs of these foods. So there are a lot of communities that ultimately don't really have great access to quality foods. So we're expecting our patients, you can think about it as like we're expecting our patients to be able to eat healthy and take care of their bodies. But if it doesn't even seem like those people have access to quality foods at an affordable price, they're not going to be able to do that very well. And I can just imagine, again, from the perspective of the physician, it can be hard to expect somebody to eat a nice Mediterranean diet and take care of their lifestyle if they're over a mile away from the nearest supermarket and McDonald's is there nearby. It's going to be pretty difficult to have that person optimize their health and their lifestyle. Now, I want to go a little bit deeper into this, and I want to point our attention to an article titled Food Insecurity, Neighborhood Food Environment, and Health Disparities. And there's a point that they bring in here that I think is going to tie some of this stuff together. Now, what they found was that one recent longitudinal analysis found that higher diet quality was associated with proximity to and density of food stores, neighborhood socioeconomic status, and with perceptions of healthy food environments. So again, if we want to ultimately be able to eat healthy and to have a good diet, there needs to be some access to those things. But there's a lot of communities across the United States that don't have great access to quality food. Another point I want to illustrate here is the fact that, again, you can imagine if someone is living in a food desert, living in a community where there's not great access to quality foods at an affordable price, their health outcomes are going to suffer. And to point that out, I want to point our attention to one particular study, the Association of Food Insecurity and Risk of Mortality, a systematic review and meta-analysis of large-scale cohorts. So specifically what happens here in this study is they do a meta-analysis and take a look at what exactly is the association between food insecurity and mortality, death. And what they found was that after synthesizing 19 studies, 18 cohort studies, one cross-sectional study, a significant association between food insecurity and both all-cause mortality and cardiovascular related mortality. So clearly there's a connection there between food insecurity, not having access to those quality foods, and ultimately not living as long. They found a significant relationship between the two, and another detail, there was a stronger relationship in Canada compared to the US, but again, I think this is something that applies very directly to the health of a lot of people in the United States. Now to go a bit further, again, I'm going to really push this point forward. Looking at a study titled The Association Between Living in Food Deserts and Cardiovascular Risk, what they found was that compared to those that were not living in food deserts, subjects that were living in food deserts had a higher prevalence of hypertension and smoking, higher BMI, fasting glucose, and 10-year risk for cardiovascular disease. So obviously, again, food insecurity is something that impacts health outcomes, so it's something that we definitely have to keep in mind. Now, to go a bit further into this topic, I want to talk about another aspect of things that may be easy to overlook, but I think is important. There's a number of different factors when it comes to people's lives that really intersect with this problem of food deserts and food insecurity, and I think it's something that's worth paying some attention to. There's the fact that certain communities are going to deal with higher rates of food deserts compared to other communities, so there can be some discrepancy when it comes to these things. And factors like lower income can exist in a lot of the communities that have higher rates of food insecurity. But another point that I also want to talk about here is the fact that demographics can also connect to this particular issue. And I think one important factor that has to be kept in mind is that food insecurity correlates with race in a lot of these communities. And to highlight this, I want to point our attention to another study titled Food Insecurity and Poor Health, Understanding the Mechanisms and Informing Better Solutions. And what they emphasize here is the fact that a lot of communities that are predominantly non-Hispanic Black and Hispanic have higher rates of food insecurity. So they basically compared both food insecure households to food secure households, and they were able to find some different factors that intersect with that. Specifically, they note that many differences were identified among individuals living in food secure versus food insecure households. The latter, so food insecure households, pay attention to this, were more likely to be younger, identify as non-Hispanic Black or Hispanic, have lower education and outcome and income, be unemployed, lack regular healthcare access or private health insurance, not own a home, or be unmarried or living without a partner. So there's a number of factors here that also connect to this idea of food insecurity, that there are certain communities that have certain demographics, that have certain lifestyle factors, that have higher rates of food insecurity and are suffering from this problem disproportionately compared to others. And I think something that, again, has to be kept in mind, I think something that's worth noting is the fact that predominantly non-Hispanic Black and Hispanic communities have higher rates of food insecurity. So I think it just shows that food insecurity is a key part of the legacy of structural racism in the United States. And again, lower income is something that has to be thought about. There's a lot of these communities that are more food insecure tend to not have as high of income. Now, I want to, again, go a little bit further with this. Looking at another study that titled Examining the Impact of Structural Racism on Food Insecurity, Implications for Addressing Racial and Ethnic Disparities, they highlight that an analysis examining trends in food insecurity from 2001 to 2016 found that food insecurity rates for non-Hispanic Black and Hispanic households were at least twice that of non-Hispanic white households. So clearly there's some discrepancy here. Again, kind of getting back to that point of predominantly Black and brown communities tend to be dealing with food insecurity at higher rates compared to other communities. Now, I've talked a lot about the problem here. I think at this point you guys can kind of see that, where if you have communities that are food insecure, that are food deserts, that don't have access, that where people can't just easily go to a supermarket and get quality food at a good price, their health is going to suffer. They're going to have higher rates of all-cause mortality and cardiovascular mortality and all of those things. But I want to talk about how exactly do we try to address any of this stuff. We know that the problem exists, and ultimately from a healthcare perspective, we want to be able to provide quality care to patients. We want to care about preventative health. We want to make sure that people are eating healthy and that they're able to take care of their lifestyles and ultimately have better health outcomes. So there's a number of initiatives and programs that specifically tackle this issue of food insecurity and really try to take this on. And I want to highlight a couple of them. Some of them might be familiar to you. So first, there's the WIC Farmers Market Nutrition Program. Another one is Senior Farmers Market Nutrition Program. Also, the Nutrition Assistance Program for territories. And something that might be familiar to a lot of people is SNAP, and the fact that SNAP benefits are often something that's used to try to get people access to food that they need. Now, from an individual perspective, though, I want to talk about something that I think we all might be able to relate to just a little bit. And that's the fact that food insecurity is something that I think we can address by becoming more aware of it, first of all. So again, I want to use that example of you're a physician working at a family practice and you have patients that are coming in and maybe their lipid levels and their A1C and different things like that aren't in the range that we want them to be, and they're at risk for ultimately some poor health outcomes moving forward. I think it could be very easy for some physicians to look at patients that are coming in and then after 6 months come in again and there's no improvement to think that, oh, this patient is just non-compliant. They're just not adherent. They don't care enough about their health. But I think one thing we have to keep in mind is, what are the social determinants of health? I think it's important that we don't just assume that patients don't care about their own health, but we have to keep in mind that what are some factors that may be influencing them? What's their socioeconomic status like? What community are they living in? Do they have access to quality foods from a supermarket that's close to them? Those are all things that I think we have to really keep in mind. And that's something I want to make sure I have in mind whenever I'm going to be working in communities trying to treat patients and take care of and help them take care of their health and their lifestyle. One thing I think we should do is that we make sure we center our treatment plans around patients' access to resources. I remember a podcast interview that I did a while ago, I think a couple years ago. I remember talking to someone on the podcast and how they were, I'll try to maybe link that interview up somewhere, but I remember talking to this person and they were emphasizing how a lot of times we might be thinking a lot about sort of policy changes, and I think those things can be important. But I think one thing we have to think about actually being involved in these communities and making this stuff translatable for patients. So what I mean by that is, like, sure, we can try to build more supermarkets and try to make sure there's funding for all this stuff. But I think another thing that we have to be able to do is recognize that there's going to be patients that have their respective culture, that has certain foods that they want to try to cook. And I think from a caretaker's perspective, from a care provider's perspective, we have to be able to understand what our patients' values are. We have to be able to understand our patients' culture. I think that's where cultural competence comes into play, and try to find ways to incorporate these healthy foods and better access to quality foods into whatever practices or diet they already have. Now, another thing I want to talk about is the healthcare education aspect of things. Because I think it's possible that one of the reasons that maybe we're not as aware of things like food insecurity is maybe because a lot of medical schools might not be talking about it enough. Now, I want to think that there's a lot of improvement on that front over the past number of years. I can definitely say the program I went through with undergrad and also med school definitely made sure to have an emphasis on social determinants of health. And they made sure to specifically talk about issues like food deserts, so that we were aware that, hey, there are a lot of patients that are coming from different backgrounds that might not have the same access to quality foods. And I think if we make sure to incorporate those things in our med school curriculum, we're going to have a lot more doctors that are aware of these issues so that we can better address them. The solution to this doesn't just come through policy, but I think it also comes through people being on the ground and working in these communities. And there's a lot of ways that we can get involved with that. There's things like community gardens, there's things like food banks. And I think it's important, and I'm saying this to myself as well, I think it's important that we find opportunities to get involved in these communities and make sure that people are getting access to the quality nutrients that they need. I think that pretty much wraps up everything I wanted to talk about with this topic. Again, I think if you want to go a bit deeper into this, you can check out the previous podcast episode that we did on food deserts. But I really did want to just reiterate the importance of this issue and the fact that when it comes to preventative health, which I think has to be a major focus in healthcare today, we have to be thinking about what are the backgrounds that our patients are coming from and what are some of the obstacles that they might be dealing with. So I think it's definitely important that we keep that stuff in mind. Now, let me know what you might think about this issue. Feel free to leave something in the comments section if you're watching on YouTube. What do you think are some ways that we can better improve access to quality foods and ultimately improve healthcare for our patients across the country? Now, I hope you're able to get a lot from this. And with all that being said, that pretty much just wraps up everything I want to talk about. And I'll see you in the next one.